Okay, well, I am calling back to order this meeting of the House Committee on Children, Families, Finance, and Policy. Thanks all. Sorry that we're starting a couple minutes late, I guess only a couple. And so we're going to call Representative Clardy down to present her bill. And I'll apologize in advance to members of the public and folks here to testify is that we're going to be trying to move relatively quickly because we got a bunch of bills and we're meeting in the evening in case you had not noticed. But we'll make it work and it's going to be okay. So it is still light out. Thank goodness. Yes, it is still light out. Some of us are taking a couple days to adjust to that daylight savings time thing. I don't know about the rest of you, but challenging. So, Representative Clardy, you have House File 1806, and I guess I'll invite a motion to bring that bill before the committee. Do that.
So moved.
Thank you, Representative Coulter. So Representative Coulter moves House File 1806, bring that before the committee. And maybe Representative Coulter, you would be willing to then move the, Representative Clardy, you would like to have the DE2 amendment adopted?
Yes.
Okay. Representative Coulter, would you please move the DE2 amendment on behalf of Representative Clardy?
So moved.
Okay. And Representative Clardy, can you just give us a sense as to the DE2? Looks like it kind of expands on your original bill and provides some more detail. Anything you want to say about the DE2?
No, basically I'm going to be covering it, but it just was done in conjunction with the Department of Education, so more of the technical aspects.
Wonderful. Okay. Any discussion, members, to the DE2 amendment? Hearing none, all in favor of approval of the DE2 amendment, please say aye. Aye. Any opposed? Okay. Motion passes. The D2 is adopted, and 1806 is in the form you wish. Representative Clardy, please begin.
Great. Mr. Chair, member of the committee, thank you for the opportunity to present House File 1806. This bill establishes statewide kindergarten entrance program. There's been some discussion in the past about moving forward with requiring that Minnesota implements a system of evaluating children upon entrance in kindergarten. This effort comes to us. This effort comes to us because of the need to make sure that we provide the most effective interventions for children in needs of services at an early age. So in other words, we're just trying to do a preventative measure. Currently, the Minnesota Department of Education, MDE, has the approval list of vendors for schools and school districts and charter schools to use for kindergarten entry assessments. The use of the entry assessment is voluntary for school districts and charter schools, and the approved list of assessments are aligned with the state's early learning standards. Most states have implemented required kindergarten entrance systems. According to the National Institute for Early Education Research at Rutgers, there are 35 states, including Washington, D.C., that require assessments of children learning and development at kindergarten entry. In 20 states, kindergarten entrance assessment covers all 5 essential domains of child development. So the DE amendment was developed working closely with the Minnesota Department of Education and provides a new language. It requires the Commissioner of Education to implement a kindergarten entry assessment program based on early learning standards. The school district and the charter schools must choose from a menu of valid and reliable measurements instruments approved by MDE. And they're aligned to the state's early childhood indicator progress and kindergarten standards and are based on the criteria to be an early learning assessment approved by MDE. It also will support the world's best workforce goal of measuring school readiness and are based in part on information collected by teachers, early professionals, families, and other partners. This legislation will provide an approved list of vendors. That's not a one size fits all, so it's a variety of vendors. The implementation of this program is phased in over 3 years, and with this full implementation by 2025. This will ensure the phased-in approach will ensure that there's integrity within the process, and it ensures that the teachers will receive the effective professional development that's necessary. So the DE amendment includes appropriation to MDE to implement the kindergarten entrance program. So at this point, we are waiting for feedback from MDE on the exact appropriation for the legislation. The bill from 2 years ago appropriated $2 million per year for MDE to implement the program. And I've also included a written testimony from an early education expert, Gigi Weinsfield, from the National Institute of Early Education Research, the NEAR, at Rutgers University for background as well. So I'm stand for questions.
Thank you so much. I know that there's a testifier, and I will note for members that fiscal note is still forthcoming on this, and I guess Representative Clardy kind of alluded to that she's still waiting for word from the department about kind of what will be necessary to fund this exactly. But of course, all that'll be coming through soon enough. There is one person who signed up in advance to testify, Cindy Cunningham, so please make your way on up. And then identify yourself. I'll ask you to take just no more than 2 minutes, please. And we're glad to have you. Please.
Nice to be back. So I am Cindy Cunningham. I'm a family child care provider in St. Paul, 2 miles up the road. I am also the public policy chair for the State Association for Family Child Care Providers, MCPEN. We have an acronym, of course. My goal in advocacy for family child care is just to make sure that what is passed and stuff is positive, is supportive, and unintended consequences are not present. In this case, we are grateful for the change of the small word from may to must. There are many decisions that you as a body and as a full body make based on I will say faulty data when not all schools are required to present, to do the evaluations, and yet our children are deemed not prepared, and yet we don't know fully what that means from a statistical standpoint. So we welcome this. One of the things that we would like as family child care providers, because of some of the messaging and things we get, we would be really interested if in the evaluations that there's an insurance that the question of what was the child's experience before they got to kindergarten, where were they, what were their educational standards, what setting were they in, and then look at where their status is in that assessment so that then we can then best meet the needs of these children before they get to that kindergarten and make sure that we're funneling money and time and effort to the appropriate settings in the appropriate way to make sure that there's accomplishment there. So thank you.
Thanks for your testimony and thanks for your work, Ms. Cunningham. I believe, Representative Clardy, you referenced some handouts, and I think that they were sent in too late to be distributed ourselves, but that there's maybe somebody in the room who has copies for members. Maybe Ms. Guerin, I'm not sure if she's here, but we can get them you can get them to a page, perhaps, to distribute if we can have that happen. So is there any other, while we're doing that, is there any other member of the public who wishes to testify? Not seeing any, so we'll go to member questions. Representative Zalesnikar had something, so we'll go to you.
Thank you, Chair Pinto, and thank you, Representative Clardy. My question was what you were alluding to, that if this was a must, and in the sense of a mandate, that there would be some way to be looking at what setting and experience the child had before coming to school. Because right now this committee is also looking at where we're doing early childhood scholarships and grants, so we can see correlations between successful measurements and child readiness for kindergarten. So that was something that I was curious about. Thank you.
Yeah, Representative Clardy.
Okay, so just recapping your question, you're trying to see if this is a must? Was that the nature of the question?
Representative Zalesnikar.
Thank you, Chair Pinto. One question was that with the must, it looks to me like it was changed, the word that we must provide this kindergarten readiness. And with doing that, then that the questionnaire of doing the readiness would also have an evaluation system for determining where this child was before, what programs they were enrolled in or not enrolled in prior to coming to kindergarten.
Representative Clardy.
That's a great question. I'm probably going to phone a friend to come down. But one thing I do know is that part of the assessment would be based on information that's also given by family or other partners. So so we will be gaining some information from people that have been in contact with the child previously. And the focus will be looking at like social, emotional, and physical, and language and cognitive, literacy and math. So we'll be collecting the information we have, and then I'd like to Chair
Yeah,
Pinto.
absolutely. Yeah, we'll have your testifier provide a little more. So please identify yourself and proceed.
Thank you. My name is Chaz Anderson, working here with Representative Clardy on the legislation. I think it's a good point that was been brought up about where the child was previously before the entrance assessment, and whether or not we can make a correlation and look at the effectiveness of the program they came from previously. So I think that's a good thing that we'll take into consideration. What we tried to do in working with MDE is create time and space. So there's 3 years to implement the program, where MDE can do that work, to put in that work to make sure there's some longitudinal data on that point. So we tried to give the language as much flexibility to the department as possible.
So Representative Zlotnikar?
Thank you, Chair Pinto. No further questions.
Okay. And then Representative Hemmingson-Yager.
Thanks. Thank you, Chair. Thank you, Representative Clardy. Quick question. So my kids had to go through early childhood screening between 3 and 5 to go into kindergarten. Could you just tell me how this would differ or complement that?
And before you do, I'll just note we will have a bill coming up on developmental screening aid that I think will connect to your question as well. So that'll be good. But Representative Clardy or Ms. Anderson, either way.
Chair Pentel, I'm just going to jump in. Prior to this period of time, this specific tool was a voluntary piece, and so we're looking at phasing this into like all the public schools and charter schools, with making sure that integrity is there by providing a 3-year implementation piece. And as far as how this is different, different schools were using different measurements. So this is something where each school district will have an opportunity to choose from a list of vetted screeners. And so the assessment may look different than what your child had.
Ms. Anderson, add something to add on that? I'll go to
Mr. Chair, members of the committee, the understanding is that this assessment would address like the 5 domains of child development, including physical well-being and motor development, social emotional development, approaches towards learning, language development, and cognitive and general knowledge of the child, so the 5 domains. My understanding, the screening that you're talking about to 3 to 5-year-olds is not as comprehensive. It is more health and medically focused when they screen for the child. Like, can the child, like vision, hearing, different sort of health related issues. Someone else could speak more to the screening, but that's my understanding.
And I'm actually inclined, Representative Hemmingson-Yager, we've got somebody from MDE who can maybe provide a little more light as well, if that's okay with you.
Sure.
Yeah, okay, so gonna come on up. Okay, good. Identify yourself. Welcome back, and proceed with your answer.
Thanks, Mr. Chair. Member Shana Morse, Assistant Director of Government Relations at MDE. And just to sort of compare and contrast the kindergarten entry assessment, this is looking at, I think, trying to create a statewide data set. We don't have that in the early learning space. We don't really get a statewide data set on kiddos until they're in 3rd grade, versus the individual screening that you're talking about is looking at the individual child and what kind of supports might they need, and to help them continue on their individual progression, versus a little bit more of a pullback, statewide, systematic, and in particular for policymakers, are we putting money into the right places? Do we need to do a little more over here? Are we doing great over here? Type of thing.
Okay, Representative Hemmingson-Yager, anything else?
No, that was really helpful. It's been a few years since my kiddos went through it, and I just remember like there was balance, there was talking, there was counting, so I just wanted to see, but that's really helpful for the clarification. Thank you.
Thank you. Anything else from members? I'll maybe just note, I'll ask Ms. Mock, I had asked previously to give me some information about the kindergarten readiness assessment, and I thought it might be useful. Just a minute or two on that, Ms. Mock, if you can. Kind of a background on it. There we go.
Yes, thank you, Mr. Chair. So as you've heard, the kindergarten readiness assessment, MDE may assess incoming kindergartners, so school districts and charter schools can choose to do it, but they don't have to. They do have to use a state-approved assessment tool. and there's $281,000 each year in the base for the kindergarten readiness assessment. There's nothing in current law that requires any school districts or charter schools that provide this assessment to actually report the data back to MDE. And I don't know the numbers offhand, maybe the department can speak to this, but I recall from previous presentations that there are not a lot of school districts or charter schools that currently give the assessment.
Thank you. And I think we're spending $280,000 a year in the base for the KRA in the sort of optional form. And so I think part of the thinking here is we want to have it be something that's being used, and it's unclear how many school districts are in fact taking advantage of it. Is that right, Ms. Mock?
Yes, that's correct, from my understanding.
Okay, good. Thank you. Okay, so anything else from any other members? Seeing none, so Representative Clardy, final words on your bill.
As a teacher first grade teacher, actually for a very long time, and a reading teacher, this bill right here is set up to be preventative and kind of intervention. And the consistency of the assessment tool that's being used across the state will make a difference in, meeting each child's needs when they first enter the school set. So I think that this is a really good bill, and it has great merit. Thank you.
Thank you so much, Representative Clardy. And with that, the chair lays over House File 1806 as amended for possible inclusion in the committee's budget bill. Again, as I said, we will be expecting to get a fiscal note on this in a sense. Thanks for your work on this, and the testifiers for their work as well. I'm inclined to, and I'll check out, we have Representative Coulter head on up, and I'm kind of inclined to have the HF 993, the developmental screening aid bill next. I'm sorry for not catching that earlier. I hope that is okay with you and with your testifiers. Representative Coulter, any concern with taking the bills in that order?
I don't need to sit anywhere different, so I'm good.
Okay. Then in that case, we're going to do that HF 993 then as the next bill. And I assume that it's, you are moving HF 993 to bring it before the committee, correct?
Correct.
Okay, and I see no amendments, so please dive on in and present your bill.
Oh, thank you, Mr. Chair and members. So stop me if you've heard this one before, but we're talking about a mandate on school districts that the state does not adequately fund. House File 993 in this case relates to state aid provided to school districts to conduct developmental screenings. As Representative Hemmingson-Yager just mentioned, those of you who are parents of young kids are likely familiar with this. The screening is designed to detect factors that may impede children's learning, growth, and development. It includes a developmental assessment, hearing and vision screening, height and weight measurement, immunization review, and identification of other risk factors that may affect learning. The developmental screening process also provides for a follow-up and referral process if the results indicate a need for it, an interview with parents to discuss assessment, diagnosis, or treatment, as well as a review of health coverage status for any necessary referrals. Developmental screening aid, as you can see in the bill, you'll notice that the aid amounts decrease as children get older because developmental screening aid is designed to incentivize screening at younger ages, with the goal obviously being to catch and hopefully address issues earlier on. So there obviously is a sort of vested state interest in this happening earlier. The challenge, of course, is that this particular aid has not been increased since 2008, and costs for, well, everything have continued to increase. An OLA report from 2018 found that the state reimbursement only covered on average about 73% of the costs, and that was, I believe, in fiscal year 2016, with the result that districts had to shell out an additional $1.3 million to cover the remainder of developmental screenings. So I don't think I'm going out too far on a limb by saying that those numbers have probably changed pretty significantly and not in a good way. So with that, I think I will turn things over to my testifier who can use her expertise to delve further.
Okay, sounds good. And please identify yourself and proceed with your testimony.
Oh, thank you, Chair Pinto. My name is Wendy Webster. I serve as the Director of Community Services and Communications for the St. Anthony Wrighton School District. I oversee our early childhood programs for our school district. Thank you, Representative Coulter, for authoring this bill. I also am here
on behalf of the Minnesota Community Education Association, and I'm here to share the importance of increasing funding for early childhood screening and why the Minnesota Community Education Association supports House File 993. So as Representative Coulter shared, the purpose of early childhood screening is to identify potential health or developmental delays in children as young as 3 years of age. Early childhood screening allows school districts the opportunity to partner with parents to assess their children's growth and development to determine if children qualify for additional early childhood services, such as early childhood special education. If left unidentified, these delays could result in a gap when it comes to kindergarten readiness. One piece I do want to add from the discussion earlier is there's several pieces that are required by the state for early childhood screening. And so when we conduct an early childhood screening, we have to ask parents for the health and developmental history of their child. And we have to ask parents to fill out 2 different questionnaires. One is about ages and stages questionnaire, which helps us identify if children's growth and development is developmentally appropriate to where they're at in terms of their age. And the ages and stages questionnaire related to social emotional development. Again, to see if the parents have any concerns regarding what they see from their child's social emotional behaviors. When families come in for the screening, our staff conduct the hearing and vision screening. And then we also use a state-approved and recognized screening tool. For example, in our district, we use the MIPSI, which is the Minneapolis Preschool Screening Inventory. And then, as we talked about, we look at immunization history with the families, and then we have conversations with the parents to learn if there's any other concerns that we should know about. Representative Coulter shared some of the striking information that came out of the 2018 evaluation report conducted by the OLA. And unfortunately, there is a cross-subsidy across the state. And as we know, it impacts school districts because it really accounts for some of the direct costs that school districts incur in order to conduct early childhood screenings, which is one of 3 requirements for a child to enter kindergarten in a public school district. They have to be 5 by September 1st, have their immunizations, and the third one is to have an early childhood screening. For example, our colleagues in the Robbinsdale School District have approximately $36,000 in expenses that are not covered by early childhood screening revenue. And in Greater Minnesota, our colleagues in Pequot Lakes lose $12,000 each year in early childhood screening budget.
And I'll probably need to have you wrap up in just a minute.
No problem.
Yeah.
So just want to finish with school districts across the state incur these additional expenses each time we rescreen children and follow up with parents on referrals for vision and hearing screening with a pediatrician, refer children for an early childhood special ed evaluation, and assist parents with community resources to meet families' basic needs. Thank you.
Thank you so much. Any member of the public who wishes to testify on the bill? So seeing none, member questions, discussion. Members? Representative Hudson.
Thank you, Mr. Chair. I just want to speak briefly, offer a thank you, Representative Coulter. It can be difficult to see the member presenting from this angle. I just want to thank you for bringing this bill. Developmental screening is how my wife and I discovered that our eldest son was on the autism spectrum. And prior to that, because he was our only son at the time, no frame of reference, first-time parents, everything's normal. And so we were able to connect him with services, and he eventually got an IEP. And there was definitely a period of time where we were deeply concerned about what the prospect of his future looked like. He's 14 now, and he would tell you he knows more than me. And I'm sure there's people who would agree. But this was, in terms of leverage for dollars spent, which is something that's spoken of frequently in this committee, I can attest that this one actually works. So thank you for bringing it.
Good stuff. Thanks, Representative Hudson. Anybody else? Representative Hicks?
Thank you, Chair Pinto. Thank you, Representative Coulter. Autism Parents Unite. Absolutely important for families to have this opportunity, and the amount of meaningful impact that makes long term is huge. So really appreciate it. Thank you so much.
Thank you, Representative Hicks. Other questions or members? I should note that there is actually a fiscal note in this bill, and it turns out that we, I gather, missed that, including in packets, and my apologies for that. I guess that was an oversight. And yeah, I wonder if we could maybe we should do is have it, we can get it printed. We're going to be here for a little while, I'm afraid, everybody. So it seems like as long as we're having the discussion, it might as well be worth it for us to see that. And so if I can ask staff to work on that. I'm going to just ask a question, and we'll have to then perhaps just bring Representative Coulter back up, or we'll figure that out. We'll get it out to people. The question: how did you choose the dollar amounts in the bill? These, the $75 to $98. I assume there must be some reason to choose those amounts. Representative Coulter or Ms. Webster.
I think I'm going to have to tap out on that one.
Okay, Ms. Webster.
Thank you, Chair, and thank you, Representative Coulter. I believe when we looked at, because there had not been an increase in a decade, trying to look at what might the reimbursement rates need to be to get closer to covering the actual costs that school districts expend for this service.
Okay. And so just to get closer to it, you're saying. Okay. I know that the governor's budget has this proposal in it. I don't know if Ms. Beckel knows offhand how closely this matches the governor's proposal in this area. If you don't know offhand, that's just fine. And maybe I'm wrong that it's in the. I thought that it was, but we're not so sure, huh? We can get back to you on. We can maybe connect back on that when we get the fiscal note too. And should we do that? Okay, we'll do a little bit of. We're going to do a little bit of sleuthing. Get back to us on that. Okay. So anything else from any other members? Representative Coulter, you get the closing word for now. But again, we may end up. We'll at least get the fiscal note out to folks. Depending on how things go, we may just bring this back up to at least sort of close the loop on it. But for now, Representative Coulter.
Thank you, Mr. Chair. And first of all, Representative Hudson,
Yeah.
I feel like you just gave me the title of my parenting memoir, No Frame of Reference. I think, as has been spoken here tonight, I think we all know the value of this program. And given the amount of time that we've spent in this committee talking about the importance of caring for our youngest Minnesotans, I'm not going to spend so much time on that. I guess I would just say again that to me this kind of feels like the definition of unfunded mandate. And to put this in some perspective, the last time this aid was increased was less than a week after I graduated from college. This is an important service, and if we're going to tell our districts that they have to do it, I think we should just do a better job of covering the costs. So, thank you.
Thank you so much. And thank you, Ms. Webster, for bringing this to us. With that, the chair lays over House File 993, and I'm hoping that we can even bring it back up a little bit later just to finish up the discussion with the fiscal note in front of us. And Representative Coulter, we're going to keep you up there, and you are moving House File 2330 to bring that before the committee.
That is my motion.
Okay. And there is an A2 amendment that was submitted to us after our committee deadline, and so we're going to be having it for discussion only, so we're not going to move on that amendment at this point. No problem on that. And so we will have you, Representative Coulter, please describe the bill.
Thank you, Mr. Chair. Well, if the last bill was merely changing some numbers, this is a little bit more than that. To the chair's point, we're not going to be taking action on the amendment. Most of it is fairly technical. There are two pieces I would say that are a little bit more than that I will mention as I walk through the bill, just so that folks are aware. Excuse me. So, House File 2330 is a policy bill brought forward by the Department of Human Services Office of the Inspector General. This bill specifically deals with our committee's jurisdiction. And with the exception of one section, it's almost exclusively, I think, maybe more than one section, about child care licensing. Obviously, the bill, as I mentioned, is significant. I think it's close to 40 pages plus 4 pages of repealers. So I think, and going section by section would probably be a little bit disjointed. So what I'd like to do is sort of walk through the bill in sort of broader strokes, and then Autumn Baum with DHS can fill in the gaps that the committee may want more specificity on. So the first topic that I will speak to is how the bill addresses safety with regards to child foster care. Sections 3 through 6 and 11 clarify that license holders must be able to continue to safely care for a child in order to maintain their license. Additionally, license holders would be required to notify their licensing agency if there are changes to their mental or physical health that would impact their ability to care or pose a risk to the child's health, or if the child is removed from their home. It does also state that the licensing agency may request evaluations of mental and physical health in order to confirm the license holder's ability to care. And that piece, let me pull up the A2 here quickly. The A2 does add to that a little bit by saying that prior to assigning a specialist to evaluate, the agency must tell the license holder why they are requesting that. So moving on then, sections 13, 21, 22, and 34 consolidate training requirements for licensed foster care providers into one new section of statute. But the language in the new section is the same as currently exists. And this was a recommendation for ease and accessibility from the child foster care work group that the commissioner established in 2015. Sections 2 and 29 are both clarifying language around child care license and non-licensed provider certification reviews, replacing the phrase "at least annually" with "at least once each calendar year," and this aligns with current practice. Sections 8 through 10 all relate to safe sleeping. Specifically, these sections state that pacifiers must not be attached to clothing or have other attachments, and that sleepwear should not be weighted. They also provide greater clarity on prohibited types of sleepwear and the conditions under which infants may wear helmets, basically if they are prescribed by relevant professionals. These sections also remove outdated language, clarify the definition of swaddle in plain language, and allow for variances for cradle boards for cultural accommodation. And the second sort of less technical piece to the amendment is adding a definition of cradle board, that was, I believe, derived with consultation with our tribal partners. I thought I saw Representative Keeler's ears perk up when I mentioned that. So sections 14, 23, and 27 require more types of programs that serve children to complete training on maltreatment, and also specify that the training must be completed initially and on a yearly basis. Sections 28 and 30 through 33 all address license-exempt certified child care centers. This bill would allow them to serve children age 14 or older if they continue to be eligible for CCAP, or if the center serves only students in 8th grade or below. It also makes various changes with regards to DHS notification and administration of non-prescription medications. Sections 7 and 15 through 20 are all just codification of current applicable fire code standards, and Section 34 repeals related rules that are just obsolete. Section 12 requires all family child care licensors to use the state electronic licensing inspection checklist information during licensing reviews or investigations for the purpose of standardizing the format in which that information is conveyed.
Representative Coulter, I'm just going to pause you. Are you almost done?
I'm
Okay.
literally on
Just
the
'cause
last
I think the jump from section 34 to section 12 kind of send my head
Yes.
spinning a little bit. So I just want to make sure
Yes.
we're on track you.
That's also why I chose not to do that section by section, because it felt like a thematic approach was the better one there. So the final piece, sections 1, 25, and 26 all relate to the Child Care Assistance Program. Specifically, a reconsideration process is established for correction orders if the provider believes there are errors. And the bill also adds protections for individuals who report suspected fraud in good faith to ensure that their names are kept confidential. That was a lot of information in a very short amount of time, so that's why we have folks here who can speak to it much more expertly than I can. But that is the essence of the
No problem. Thank you, Representative Coulter. And I'll just say for members, we've both budgeted somewhat more time for this bill, of course, and it's also being laid over, so we've got a chance to kind of dive in. I was reviewing it earlier, and there's a fair amount here. Ms. Baum, were you going to be speaking to the bill, just here for questions? If you're speaking to it, then please identify yourself and proceed.
Mr. Chair, I'm just here for questions.
Okay. Yeah, please identify yourself, though, I guess, as long as I called on you at all for that.
Apologies.
Yeah.
Mr. Chair, I am Autumn Baum. I am the Legislative Director for the Office of Inspector General at the Department of Human Services.
Okay, thank you. Let me think. Let's do this first to see if there's any member of the public who wishes to testify. Yep, Ms. Cunningham, come on down. Yeah, make some space for if you can. Yeah, that's all good. Yeah. welcome back, and please, you identified yourself before, but please proceed. Yeah.
Thank you very much. I'm Cindy Cunningham. I'm a licensed family child care provider in St. Paul for 26 years. I'm the public policy chairperson for the State Association. McPinn, we are the 501c3 statewide association specifically for licensed child care. And sorry. So I will specifically address the reduction of safe sleep or of infant death and also the ELISI tool. So regarding, sorry for the interruption, we're thrilled to have this information and this legislation brought forward. I was the main testifier over 10 years ago when this was first an issue. I was known to bring swaddle sacks to legislative hearings because at that point in time, 10 years ago, no one knew what a swaddle sack was and the tool and how it was used. What this bill
There are some
brings.
legislators who could use some. think.
I know.
Anyway,
I think
yeah.
you asked me, do we have to have this again, Cindy? So, it's okay. But if I were to do that now, there are so many products and so many opportunities and so many choices for families and for providers in our settings that I would not be able to bring them all here. This bill has come about from work from myself and McPenn a number of years ago, approximately 3 years ago. The legislation had DHS put together a working group to work together. So this is the product of many stakeholders, centers, family child care. I'm not even sure who else because it's been a while. I'm looking over at Mr. Ash. So it was hard work. It was hard investment. And we finished our work, and it's just really good to see it at this point. Clear expectations lead to compliance and consistency, both by the provider and the licensor. Currently, this is not in place, and therefore providers are uncertain of some specific expectations. And also licensors do not implement on a consistent basis. These changes will bring legislation up to date for everyone's benefit, in particular the children in our care. In addition to these changes, we would like to point out a few aspects that are not specific in the bill, but we want to address. One is that DHS needs to make sure that this training is updated for family child care providers. Those trainings are not consistently updated annually to be in alignment with the legislation.
Ms. Cunningham, are you saying these are pieces that are not in the bill?
Not specifically worded out, and you're not going to.
Would you mind sending them? I'm concerned.
send them to
Yeah,
you,
if you
yes.
could.
Yep.
Yeah, if there are things
Yep.
not in the bill, then maybe that's something you can.
Yes.
If you address separately.
Yes, I've attempted to bring these up at other times and in other ways with legislation, so I can be glad to set this one to her. We're asking that there's consistency in how safe sleep practices are implemented at all child care settings. Currently, that is not the case. Regarding the ELISI tool, that seems like a small thing to have licensed.
Ms. Cunningham, pardon me. So are these things in the bill?
The ELISI tool is in the bill.
Okay,
Sorry,
yeah.
thank you. Appreciate that. The ELISI tool, the electronic system that licensors have available that this legislation brings into what I read as a mandate that they're required to use, is a tool that is powerful both for the licensor and for the provider to both have adequate and equal information. And when a licensor comes into the home and does not have the ELISI tool to compare where correction orders are, they go back to their office. They get to make a decision about whether a violation, a situation is a violation or not, and then they issue the correction order. It precludes the situation that providers are given the opportunity for an exit interview before the licensor leaves, and therefore then they can dispute the correction order in their home before they leave. If the licensor does not have the ELISI tool in their hands, then they go back to the office and that step is taken out of the hands of the provider. So this is a really critical tool that needs to be in place, that it is required. I work with providers, have a couple right now, and that what the description of what I just said is happening, and they cannot dispute before it's written up as a correction order. They can only do it afterwards.
Thank you so much. Thanks for your work.
Thank you.
Member questions, and I know and again, we've got a bit of time if folks feel the need for additional detail on some of the components of the bill, but we'll go to Representative Hicks and then go on from there. Representative Hicks.
Thank you, Chair. Thank you, Representative Coulter. You may need to phone a friend for this one.
Could I ask you quickly to pull the mic just a little bit closer?
Oh, yeah.
Oh, I'm sorry. I don't know if you'll need to phone a friend, but on line 4.7, where it says, for a family foster setting, has an individual been living in the household where licensed services are provided or has otherwise subject to a background study? So we've talked about background studies in other committees too. So I just want to clarify, would this be anybody over the age of what?
Let's get, Ms. Baum, please, if you're the right person, or somebody else.
Mr. Chair, members of the committee, I may call on my staff if they know the answer to this question. Otherwise, I can take it back to our background studies folks. We have folks here from licensing
Okay.
and our program integrity area, but
Yep. Let's see. So we have somebody who can help answer Representative Hicks's question.
do you have it? Yay!
Okay. All right. Well, Josh, welcome. And yeah, please, once you get settled in, please identify yourself and then proceed. Thank you.
Thank you, Mr. Chair. Representative Hicks, I'm Larry Hosh. I am the manager of in the licensing division. The changes, Representative Hicks, that you reference are technical corrections. They were omissions that were not referenced in previous background study law changes. So this just makes sure that the subdivision that was omitted in previous action is added in. So this is generally a technical change.
I think the question is the person referenced the individual living in the household? Would that be an adult, or could it be any person? Representative Hicks, don't want to put words in your mouth. Is that what you're asking, Representative Hicks? Yeah. So, Mr. Hosh, do you know?
So I'll tell you what my underlying question is.
Representative Hicks.
Because this happens to foster families a lot. So we are foster families, and then we stop being foster families because the 15-year-old that's in our home has been adopted. But the 15-year-old that's in our home that's been adopted has a juvenile justice crime on their record. And so would a child care provider who adopts a 15-year-old who they were fostering, who has committed a crime, lose their license because their 15-year-old that they adopted has a juvenile record? That is my question.
Mr. Josh.
Thank you, Mr. Chair. Representative Hicks, I would have to get back to you on that question. This change does not change any current requirements, and this is just a technical fix for the background studies reform that was done a few years ago. So the specificity to your question, I can get back to you. But this change in House File 2330 does not change any current practice.
And please do get back to us. And I'm just going to add, and if you could, I guess I'd be interested to know where the current law is that this is just a technical fix for, because this language does appear multiple times in the sections of the bill, which makes me sort of wonder about that. But Representative Hicks, back to you.
Yes, thank you, Chair. And so maybe there's a broader problem that I'm not aware of, or maybe that I am kind of preferentially aware of. But that's my only concern, is I don't want people to their whole livelihood to be punished by a choice of a teenager.
In looking at the bill beforehand, I had some, and I know it's given a note to Representative Coulter wondering about this series of provisions that Representative Hicks is asking about. And so I guess definitely would want more information from the department about kind of what the implication would be, and also sort of how it's a technical fix, because I guess I'm confused if it's, how all that works. So if you can make sure to get back to us, that'd be great. I'm good. Okay, good. Other questions, discussions, discussion points, members? Oh, Representative Zleznikar, pardon me. I keep missing you. I'm so sorry. Representative
That's
Zleznikar.
okay. Thank you, Chair Pinto. And thank you, Representative. My questions are, I have a few of them. On the sense, there's a part, let me get to it here, on when a baby falls asleep. And I ask this because I've visited child care settings and home care providers, and I hear from people that it's very challenging if you have a baby falling asleep, and there has to be discretion. You're on a walk and you have children in a stroller and you have various ages. One falls asleep that you're holding. I don't know if it's in a front pack or whatever it could be, but then the rules read that you should lay the baby down in the crib as soon as possible, which has to be judgment, because if you're on a walk, you're outside. And not only that, but when I ask the teachers and the providers, there's some children that, may be asthmatic, may have a lot of they have different needs. Every kid does. And some of them said, look, there are times when that child just needs to be held. And the minute you place that baby down, it's just crying. Continue, you it's a continual pattern. And I can understand that being a mom with 2 different kids in those early ages, how challenging it'd be. I mean, I went in the crib room and I watched, and I asked, how in the world do you ever get 6 of these children this age to sleep? They can't have their pacifier, they can't have a blanket, they can't be held. You know, some of them don't, you know, some of them they have all different. I worry about the emotional need of the child too, as much as getting being able to sleep. When you're sleep deprived, you're not going to do well as a young child. Mine would go into more asthma attacks when he was, you know, distressed as a young child. So I just wish there was more flexibility for center daycare providers and home providers, because I heard it from all of them. I would like your feedback on that question before I ask the second one, because I just think it's an important thing for especially young children, to be able to be held.
Mr. Hosh, if you're the right person, or?
I can do my best.
Okay.
I've got phone a friend on my computer as well with people responding. Representative, Mr. Chair, Representative Zeleznikar, the hypothetical you provided with a baby falling asleep while on the walk, as soon as practicable, that would not require them to end that walk and put the child to bed right away. You can finish the walk. You can meet those individual circumstances. I too, like yourself, I have 3 children at home, family child care, and I can't imagine how you can balance putting 6 kids to sleep. But we aren't so strict where you have to end the walk in your hypothetical and put that child to sleep.
Representative Zeleznikar.
Chair Pinto, well, a lot has changed since I had young children. The rules have changed significantly, and I just think about what I would have done for childcare with an asthmatic kid who was allowed to sleep on the couch, propped up in the home daycare, because that's how he slept best. He was never laid in a crib, and I would have never had childcare for that child to be able to go to work. And I can't imagine there aren't other people that have children that don't fit the perfect box. And I had one that did and one that didn't, but I was grateful that the provider had enough common sense to be able to do that, and the rules allowed for it. And it saddens me to think that that's not the case now, because a child like that, whether it's autism or, you know, medical issues, children that are born early, they're developmentally delayed, and they need something different. And so to treat them all the same and not have the provider have enough ability to make a decision like a parent would. They're acting as I would. I held him in a pack walking around the house and he was sleeping. So I just think there should be more judgment allowed. It could be right in the center and 4 are sleeping and 1 sleeping with you. But if that's what the person thinks is best, you can feel them breathing when they're with you. So I just think it should be something. And the second part was on the count of 14. When I've talked to home daycare providers, it's my understanding that the children of the parent are counted in that count. So if you have 2 children and you have 14 allowed in a home center, you have to deduct your own children, so you can have 12 then. Is that correct?
Mr. Hosh.
Mr. Chair, Representative Zeleznikar, for some of the situations like having a pacifier, being able to be held while sleeping, you can absolutely do that right now. The safe sleep recommendations are from the American Association of Pediatrics. They've had 2 updates in their recommendations since we've been able to update our safe sleep standards. The work group was put together with a broad swath of stakeholders that support this legislation. On the limits and ratios for family child care centers, this bill does not affect or change any of those limits, so that I think is a discussion for another point. But on the safe sleep standards themselves, the hypotheticals that you presented can occur depending on the situation. And a child can be held, a child can have a pacifier, it just can't be attached. And this follows a large group of consensus with the American Association of Pediatrics and their recommendations.
Representative Zeleznikar.
Thank you, Chair Pinto. I think in talking to providers, it depends on who surveyed them when they've come into their setting on what is the subjectiveness. And so, that ability to make that decision, that scope between licensing has not all been consistently the same. That's my only feedback that I hear from people in my district.
And I'm just concerned when we have 700 less family childcare providers, how we do the count and whether it's appropriate at this committee or not. If you have 2 children and you can only provide for 12, it's for many of these people, it's not cost prohibitive to be able to do home-based childcare. And that's where many of the people have said they've closed their home daycare and they have went to work for a center because their kids aren't counted in the count if they work for a center. So I think it's something we need to know. Thank you.
Thank you, Representative Zakar. Yeah, we may be getting a little bit beyond the scope of this particular bill, but certainly ongoing conversations. Other member questions or discussion? Vice Chair Keeler.
Thank you, Chair Pinto. Thank you, Representative, for this. Okay, I am going to make a statement that's probably not, I just feel like I need to say it on record that this gets really frustrating. So really little things will remove children from a family. On line 7.29, it talks about that if a license holder is responsible and in the result is a serious maltreatment, it's only a fine of $5,000. So I think it's really frustrating that like things that centers can get away with and just be fined are actually reasons why children are being taken out of homes in the child welfare system. So I just need that to be on record. I think that that's really complicated and that's not safe or not fair. What I do have a question about is you address some changes on the medications that children can have, adding non-prescription medication. The one piece about it that I feel like is not addressed, and now we're on like 40.8 through 40.20, is there's nothing in here requiring that the medication has to be in the right temperature control. It just says it has to be in the right container, the child's name, not expired. Is there a reason why we're not adding the accurate temperature control? Because I have a child that needs to take a medicine that's refrigerated. So can you answer why that's not in there, or if that's something that maybe we just overlooked and needs to be in there?
Mr. Hodge. Or
Sorry,
Representative
Mr.
Coulter.
Chair, I personally can't answer
Yep, let's
that
just move.
particular question.
Let's just go to you testify. Mr. Hodge.
Somebody could,
Mr. Chair, Representative, this particular provision just aligns with what we do for licensed exempt certified centers, along with aligns with what we do for child care centers and family child care. The specificity on the temperature control, I would have to get a better answer than what I could answer for you now, if that was an omission or if that's a standard that we have on our regular inspection visits.
This is helpful. If I'm just as I'm understanding, because I had been curious about this before. So you're saying that the language here in this section 32 makes license exempt centers have the same requirements as family child care and child care centers. First of all, is that right, Mr. Hosh?
Mr. Chair, correct.
Okay.
This applies to license exempt child care, license exempt certified centers. We do this practice already for child care centers and family child care. And for the question on like the temperature, the provider is required to follow the instructions on the label. So if the label says that they must be stored in a certain temperature, that would be a requirement.
Oh. Vice Chair Keeler.
I still have concerns. We can follow up offline about it. Thank you.
Good. Thank you for raising that. And actually, I had been wondering about that section, so I appreciate you clarifying that, Mr. Hosh. Other questions, discussions from members? So seeing none, sounds like continued conversation. I should maybe note that there's this bill's being laid over. We had a couple of other child care regulation bills that were laid over. It's possible that we may bring one or more of them back up before we would do a budget bill. I'm still kind of looking at that. If I will just urge members of the public, if you have comments, input on what is in this bill or the other bills that we've heard, we certainly want to hear that. And we may well be bringing things back up. Representative Coulter, though, you get the final word.
excuse me. Thank you, Mr. Chair. Well, yeah, obviously this bill is being laid over. This is not our only bite at the apple, so to speak. And I did also want to mention, I know it's been a topic of interest in this committee that I believe Chair Knorr is also working on some child care assistance program integrity measures. And so I'm sure folks will be interested in that as well. I guess just sort of, in closing, I know I'm usually not comfortable speaking for other people, but in this case, I'm going to go out on a limb and suggest that the department is also perfectly willing to continue the conversation on ways to make this better, on ways to address concerns that have come up through the process. So I will add that everything in the bill has been approved by relevant stakeholders, but that should obviously not be the end of the conversation. So thank you for your time and the thoughtful discussion.
Thank you so much. So with that, the chair lays over House File 2330. We did not amend it, though we had an amendment in our hands, and laying that over for possible inclusion in a budget bill or for otherwise coming back up. So thank you so much. Members, we do have the physical copies. Actually, Representative Kotyza-Witthuhn, we have the physical copies of the fiscal note. So for Representative Coulter, I'm inclined, while that's relatively fresh, just knock that out. Representative Kotyza-Witthuhn. Oh, you're in Committee on Commerce right now? Okay, let's get you on up then. Yeah, come on up. So Representative Kotyza-Witthuhn moves House File 2573 to bring that before the committee. We'll keep you moving.
That is my motion.
Okay, and then the A1 amendment, Representative Kotyza-Witthuhn, you'd like to move that?
Yes, please, Mr. Chair.
Okay, and that amendment, Representative Kotyza-Witthuhn, it looks like it's pretty technical, inserting an amounts of money.
Yes, Mr. Chair. We're removing language that was in your bill, the Great Start bill, so there's no duplicity. And then it incorporates some TA from DHS as well as fills in the blank appropriation.
Great. So any comments or questions regarding the A1 amendment? So all those in favor of Representative Kotyza-Witthuhn's motion to move the A1 amendment, please say aye. Aye. Any opposed? Okay. Motion passes. The bill's amended. Representative Kotyza-Witthuhn, present your bill, please.
Thank you, Mr. Chair. Members, so far this session in this committee, we have heard much discussion of the crisis that our state is facing in childcare. Slots are often not available, the price for families is often much too high, and across the board, we are paying early childhood educators a dismal compensation rate, lower than even that of dog walkers. Higher education institutions are reporting having issues recruiting and retaining candidates for their early childhood programs. The candidates who pursue early childhood education face difficulties finding apprenticeship opportunities because, frankly, there aren't many places that can offer a program that's financially viable when most places are struggling just to keep the doors open. We know that the first 5 years of a child's life are absolutely vital to shaping who they will become. And it's important for the adults caring for our littles to be well-trained, qualified individuals with the right tools to help our kids thrive. This sector has struggled too long, and we have the opportunity right now to help us recruit more folks to the profession and professionalize and better compensate the workforce behind everyone else's workforce. We've already heard the Great Start bill in this committee and will continue to discuss our own proposals as well as the governor's recommendation to help uplift our community of early childhood educators. House File 2573 is an important piece of that discussion. I have Ann McCulley from Transforming Minnesota's Early Childhood Workforce today to explain how this bill fits into the bigger picture, and also Hope Durner, an early childhood education faculty member at Minneapolis Community Technical College, to illustrate how this bill will impact our early childhood workforce.
Thank you so much, Representative Kotyza-Witthuhn. And Ms. McCulley, thank you for all of your work and for being here. Please identify yourself and proceed.
Sure. Thank you. Thank you, Chair Pinto. Good evening, everyone. My name is Ann McCulley, as said, and I am here in my capacity as co-chair of Transforming Minnesota's Early Childhood Workforce team. The early care and education workforce serves children, families, businesses, and our entire economy. Transforming Minnesota's Early Childhood Workforce team was formed in 2016 to build on the recommendations of the Transforming the Workforce for Children Birth Through Age 8 report from the National Institute of Medicine. We want to ensure that Minnesota's early educators are qualified, diverse, supported, and equitably compensated, regardless of setting. There's a graphic, and I know you have a plethora of handouts tonight, but you will see a graphic that talks about some of the work we have tried to do collectively and now is reflected in a number of vehicles. Looks like a mountain. And it talks about efforts, particularly around efforts to address compensation for our workforce. Many of the precursor ideas of transforming the workforce show up in the Great Start for All Minnesota Children report, and many of us served on that task force. And so, again, as Representative Kotyza-Witthuhn mentioned, there's one other handout that does sort of try to lay out for you how these nest together. There's a vision page, and basically what I want to make clear is there are many, many strategies involved with trying to support our early childhood workforce. Some of them are in that Great Start Act of 2023 bill you heard last week. Many will be in the governor's bill, which I believe you'll be hearing this week. So this bill kind of looks at all of those and said, here's a few more strategies, in particular that relate also to higher ed, where we know we can either increase access to higher education for our early educators who want to take that path, and how we can better align our higher ed and our early education systems. So I'm here for questions at the end and more conversation as needed, but I'd really like to give the bulk of my time to Hope Dorner. So I'm going to step aside.
Okay, great. Thank you. Please, once you get a chance to settle in, identify yourself and proceed.
Thank you, Chairman, representatives. My name is Hope Dorner. I'm a faculty at Minneapolis College in the Early Childhood Education Department. I'm here today to share with you the need for continued and increased support for the early childhood education profession. As a person with over 35 years of experience in the field, I can honestly say that the need for support has never been so great as it is today. I see on a daily basis students at my college wanting to improve their skills with children and improve their practices, but are struggling financially to make ends meet. This bill allows for the continuation of support for those who are currently in the field seeking college credentials, as well as encouraging more to join the field in the Empower to Educate or the new apprenticeship program. The Teach Early Childhood scholarships are truly the only way that many of my students can afford to get a college education. This opportunity allows the students to have at least 90% of their costs covered by the scholarships and support from their program. The scholarship allows them to have all of their expenses covered, tuitions, fees, books, computers, etc. This allows students to stay debt-free in an industry that is vital to the overall economic success of our state, while not always providing them with the wages that they deserve. I will say that most of my students are currently working in the field and are looking to improve their practice and opportunities for their long-term careers by gaining a college degree. What has been helpful is the addition of the early childhood education programs to the Workforce Development Scholarship Fund. This funding can be used alone or in addition to the Teach Early Childhood Scholarship, which they then can use to help with other costs like transportation and cost of living expenses. The difficulty some students face is the competition for the Workforce Development Scholarships. The reason for the lower percentage of students in the early childhood education field accessing these scholarships can vary from campus to campus. We know that the state does not have enough spaces available for all of the children whose families want to work. Some early childhood programs servicing families have closed, and others do not have enough workers to fill the remaining open positions that they have to meet the need. It is time to look at carving out a set amount of money specifically for the early childhood education programs within the Workforce Development Scholarship to help alleviate this shortage. This dedicated funding can also help campuses market specifically to encourage more students into the field of early childhood education, benefiting not just those students or programs or families, but the state as a whole. Thank you.
Thank you so much for being with us and for your work. We have, I know, at least one public testifier who signed up in advance. Cindy Cunningham, please make your way on up. And once you settle in, please proceed with your testimony.
Good evening. Cindy Cunningham, Family Child Care Provider in St. Paul, the Family Child Care State Association Public Policy Chairperson. One, I want to make sure to make a note of a lot of what has gone on as you all show up frequently, consistently, to work on behalf of all of these things. I will say as a public person, I keep track of this. I also work. And it's been very difficult to keep up with every single piece of the bills. I can't imagine what it's like here, but I want you to understand that keeping track of it and being able to speak to it from a knowledgeable standpoint has been very difficult. I very much am appreciative of the evening hearing so that I have the opportunity to come. The virtual is missed. So there's my little commentary of things. I have had the privilege of being in the Great Start Task Force, I showed up once a month to the meetings. I showed up once a month to additional compensation meetings to discuss all of these details. I've attempted between the task force closure and this bill introductions to be in discussion with those moving bills forward amongst other bills that are moving forward for the Great Start. I've basically been met with silence and non-engagement in conversation. Hence, I'm bringing forth some family child care perspective directly to you, hoping for something more than the silence. The Early Childhood Apprenticeship Program is something that, in general, we support the efforts, and because family child care is included. We have family child care providers who have participated in similar programs, and the ability to educate on the high value and opportunities with our industry is welcomed. We have concerns about others in the system who do not value family child care, and actually whether they will actually utilize family child care settings for these kinds of programs. There is an ongoing experience of family child care providers who enter higher education where they are not valued by the higher education setting, and they have been discredited and have heard higher education staff dissuade individuals from going into family child care. If this continues, this will not benefit the overall industry. We are aware of, there is a similar, it's not my pattern to try to speak negatively about things, so this is difficult. There is childcare where it is moving forward with an apprenticeship program, and I know the reasonings behind it, but there is family child care is not included, as in the centers are included. There's barriers that are for this, but to us as a view for family child care, this is a consistent and a persistent approach. We are second, we are not understood, centers are understandable, staff at centers are understandable. We value centers, but to the point where family child care is diminished is an ongoing experience. The competencies task force, it became clear that this difference.
Actually, Ms. Cunningham, that section was deleted out of the bill.
Okay, is that being put back in the House Great Start piece that was heard last week?
It's our budget bill, if it, has not been prepared to the point, so that's not in front of us.
Will there be an opportunity to speak to it another time?
If it comes back up, there certainly will be. Oh, yeah.
Okay.
Yep.
Thank you.
Thank you so much. Good, and thank you for your work. So members, any other members of the public, I should ask that first, who wish to speak? Not seeing any, and so we'll move to member discussions and questions at all. Representative Hudson.
Thank you, Mr. Chair. First of all, I'll just say conceptually, I like the idea of an apprenticeship program. Apprenticing is some wisdom from our elders, past generations, that I think has fallen out of practice in a lot of sectors of the economy, and reintroducing it as an idea is, I think, a step in the right direction. I'm curious about this, and I'm going to have to turn the page to remember it exactly. Recognizing comparable competencies to achieve comparable compensation task force.
And that's the part that was taken out of the bill, Representative Hudson. Just
it was taken out.
That was, that's, at least I'll maybe confirm, yes, that section is no longer in the bill.
All right, then I have no questions.
Oh, well, there you go. That simplifies life. There we go. Okay. Other member questions or discussion? I'm sorry, Representative Nelson, please.
Thank you, Mr. Chair. And a question I have is, what is maybe there's a definition of what an apprenticeship is for a length of time. Is this a semester? Is it a year? Just kind of wondering what the scope of this entails.
And Ms. McCauley.
Yes, hi. Sorry, it's really hard to see everyone.
Yeah.
Mr. Chair, Representative Nelson. So this is a good chance for me to elaborate on the fact that we are working right now with a model that's out of the National Teach Center. So Teach is the early learning scholarship that Hope Dorner just mentioned, that's also in the governor's bill. It's been around for about 20 years as a straightforward scholarship for people who are already working in early childhood who want to go back and get their degree. What they've developed is a model that will supplement with that. Actually, it will meet the National Department of Labor and Industry guidelines. And what we're working on in Minnesota is to further make it meet Minnesota's guidelines. So Department of Labor and Industry, Department of Human Services, our office that works on Teach are all working together on launching a short pilot in June of an apprenticeship. And then what this bill is doing is hoping to grow that funding, because that funding will end, and build a longer apprenticeship. To your point, there are probably others who understand apprenticeships even better than I've had the crash course of, but the main issue is it involves on-the-job training, which in our version would be you're working in a child care center or family child care home, and we are working on a model for family child care homes. You receive support in the form of a mentor, so somebody who can be there with you and help you guide your way, and then you receive college training, and that's where we're blending it with the current Teach scholarship, so that allows you to go back to school. One of the amendments tonight was to take out reference to an associate's degree, so it could also be a bachelor's degree or even more, and I believe what we're working on right now is an up to 24-month option, particularly if somebody's going to pursue an AA or a BA degree, where they can be working across time on their apprenticeship. So it's trying to take the sort of typical registered apprenticeship model that exists in a lot of other industries and make it fit with childcare. The other quick big differences you'll see is there's money there for the actual sponsoring agency, meaning the childcare program. There's money for a mentor, and there's, of course, the money for the college scholarship. Because childcare, as you all have heard, tends to not have a lot of cash in order to buy into something like an apprenticeship, this model would offer that sort of sponsorship to help our childcare programs engage in the apprenticeship model.
Representative Nelson, follow up.
Yeah, I thank you for that. I think that helps, kind of understanding all what is entailed in that. And I agree, as Representative Hudson said, the apprenticeship model is, I think in many ways something that works. And we often see it in the construction trade and things like that. And I think, oftentimes, there's generational wisdom to pass down of just experience that you don't always get from a book, from a classroom, and I appreciate that, and I think that's working in a good direction.
Ms. McCulley, Representative Kotyza-Witthuhn, please.
Thank you, Mr. Chair. Yes, and I do want to add, it's not in regards to the timeline of the apprenticeship definition, but I do want to add that I am in conversations with the Department of Labor and Industry, and they have been working to frame up a very similar type program. So we are going to have ongoing discussions with DLI and DHS to see if it makes sense to layer this on top of the prep work that they've been doing for the last year. They're hopeful to kick off that child care related apprenticeship program as of September 1. So we will, I'll report back to the committee with additional details.
Thank you. Members, other questions or discussions on the bill? Vice Chair Keeler.
Thank you, Chair. Thank you, Representative. I should not have grabbed a red pen because for some reason it feels like I just need to mark up these bills with a ton of questions. So also sorry if I go to a part that's been removed. But so we're not doing the task force. Is that right? That whole part is.
That section's been removed in the amendment. Yep.
So so one of my questions is 1.23, you have to be 18 years or have a high school diploma. Would that include a GED? Because I know that there are some spaces that, for employment purposes, a GED doesn't always show up as an equivalent to a high school diploma. So could you clarify that first?
Ms. McCulley, I suspect the goal would be to have it, but Ms. McCulley?
Mr. Chair, Representative Keeler, I sit here not completely sure. I think this is what a lot of this mirrors is what we're being told needs to go into a typical apprenticeship model. So I think I'd have to find out if that is an option and let you know.
If we could definitely look, maybe I'll ask Ms. Mock, if you could just keep an eye. I don't know if you have an answer now, but otherwise, if you could look into this point. So, okay.
Mr. Chair?
Yeah, Representative Kotyza-Witthuhn.
I just want to say in general, that's something that I would be supportive of.
Yeah, I would think.
If it follows other requirements.
Okay, good. And let's see, something else, Ms. McCulley? Oh, okay, so Vice Chair Keeler back.
Hope
Ms.
is
McCulley.
saying that colleges do have, pardon me, Mr. Chair, that colleges do have GED or. So it may very well be, it's just not explicitly stated here. So
we're going to have Ms. Mock make sure, and so if this does advance, to make sure that language does include, it sounds like the bill's authors okay with that, to have that, be sure it does include it. But Vice Chair Keeler.
Yeah, thank you. I figured it would. In my time in higher ed, this was a big conversation and making sure that is really detailed in there because we've seen that used against some people who've gone back for GEDs. The workforce development scholarships, that is still in, so 5.25, right?
That is in the bill.
Okay.
Following along at home. Yeah.
So I have some questions. So again, I used to sit on higher education, and this was something that I really believe in. But my question is about the ask in the funding. And so when I just asked the chair, this is not going to higher education, correct?
Representative Kotyza-Witthuhn or Ms. McCulley? Representative Kotyza-Witthuhn.
Mr. Chair and Vice Chair Kuehler, yes, that is correct.
Okay.
My
So
understanding, I think that Chair Pulowski has waived hearing this. Vice Chair Kuehler.
I just wanted to make sure, so I'm going to ask some questions with that hat on, knowing that it's not going there, because I do have some questions. So is there any data that shows the engaged interest of individuals wanting to go into the early childhood? Because mathematically, when you look at the statute around this, it says that each individual only gets $2,500 for 2 terms. That's what the statute says. So then that's telling us that we're asking for funding to offset 100 students one year and 100 students the next year. So I'm just wondering, what data do you have from a higher ed lens that says we have people in Minnesota, 200 individuals in Minnesota that would do this, or is this just a goal?
Ms. Dorner, I think I'm saying your last name correctly.
Okay,
Yeah, please.
you.
Yeah.
Thank you, Chair and Representative. So I can speak to my program alone at Minneapolis College. In the fall, we had 23 applicants just at our college alone for this scholarship. And so if we, and there are, I do believe, like 22 programs in the state in early ed. I'd have to double check that number. So not every program is going to be as large as ours. And what I haven't been able to do is, for some students, if the money runs out at a college, because each college is allocated a set amount of workforce development funds that goes to all of the different programs within that funding category. And as soon as, and depending on the college, and this is where it varies, sometimes it's a first come, first serve. And if you've got, a nursing program or a technical program that also fits this category, we may not get those students as quickly in the queue to be able to honor that potential commitment of cash. And so having this allocated separately, knowing that we can then market to the students saying, we have this money to make you in this industry that doesn't make as much as some of the others that are in the Workforce Development Fund, say you can go to school and get your degree, and it's not going to be a burden on you for loans and debt at the end.
Vice Chair Kuehler.
Okay. Yes, all of that, right? We know that. But the problem with the workforce development scholarships is that it is expanding. We know that this year that the ask is adding it's police, force, education, and construction already to the 7 programs that are already listed under here. They already have a $9 million base, and they're asking for 25.5 additional. So I'm worried that adding the funding into this component is maybe not the best, because it is so broad that if we want the money to go directly into future child care professionals, that the Workforce Development Fund in higher ed is growing to a lot of different areas. And I just want to express the nervousness I have for that to be the vehicle to fund what we're doing, because I agree. I mean, I would love for this to even say that high school students could get credit, because I know that we're talking about that in spaces too. I just want to caution us that I know that this looks like a really good idea, but working in partnership with higher ed and the fact that it's not going there, I just think we maybe need to think outside the box a little bit for a long-term sustainable funding program for this. I'm sorry, I just needed to make sure that we had that under that we actually talked about that. And with that, I mean, I know that we don't want to add more stops, and I know that the chair waived it, but I do think because of that, I would just encourage us to maybe think about having a conversation in higher ed around that as well. Thank you.
Thank you, Vice Chair Kuehler. Representative Kotyza-Witthuhn, if you have anything to say, or Ms. Dorner,
Yes.
please.
Thank you, Mr. Chair. And I did just want to clarify, it's my understanding that this funding would be earmarked for early childhood programming. So I don't know if we need to double check the language, and I can work with Ms. Mock on that. But I do appreciate your statement there and in your experience in higher ed, and I would be glad to tweak that as needed.
And I think it is dedicated, the language in the bill is dedicated exclusively to early childhood, so, but on ongoing conversation, you got something else you want to, David, something?
Yeah, I mean, I guess publicly, that's not really, it's adding so much more work behind the scenes to earmark in a program that we're growing in a way that I
I just want us to be really cautious that in the front view of it as we read it, it looks really great. Behind the scenes and what the Office of Higher Education has to do for this, it may be more cumbersome than it is actually beneficial. But I would love to talk about it more behind the scenes. Thank you.
So we should probably move on, not seeing anybody else have their hands up. So Representative Kotyza-Witthuhn, you get the last word on your bill and ongoing conversation clearly. Please.
Yes. Thank you, Mr. Chair, and thank you, members, for this great discussion tonight. I'm happy to be back in Children and Families for a little while from my Commerce hearing, which is where Representative Davis was when he stepped out. So we switched places for a minute. I think that this bill is really critical as we look at expanding the workforce and just reaching additional people who have an interest in moving this path in their education and in their profession. I think it's knowing that at least right now the salaries are untenably low for most people to be able to earn a living wage, and then kind of the additional hurdle of having to take on debt in order to gain a degree in this area. I think that gives a lot of people pause when they consider what they might want to do for their career. And so I appreciate the committee's consideration. I know that we'll have the opportunity to have an ongoing discussion about this and discussions behind the scenes, including DHS, the Department of Labor and Industry, as well as the Department of Higher Ed. So thank you so much.
Thank you, Representative Kotyza-Witthuhn, and thanks to Ms. Durner and to the folks who put this together. I know you've been working really hard on behalf of the early childhood workforce in our state, so thank you so much. So with that, the chair lays over House File 2573 as amended for possible inclusion in a budget bill. And so Representative Hicks, you are up. House File 2665. Representative Hicks moves that bill for possible inclusion, or moves it to bring it before the committee. And Representative Hicks, we've got an A1 amendment, and I am guessing that you would like that to be moved, correct?
Yes.
Okay. Okay. Representative Hicks moves the A1 amendment, which is quite a small technical amendment. Hopefully folks can read it and understand it. Are there questions or discussions to the motion, the A1 amendment? Oh, Representative Hudson, yeah, please.
Thank you, Mr. Chair. I know it's not common for amendments to attract discussion or questions, but I'm just curious what the purpose of eliminating 221 through 224 is. Is that because it's considered redundant to the lines that come before it, or is it just that the commissioner, we didn't want to burden the commissioner with having to prepare a report for the legislature, or what's the mechanism?
I'm a little confused. Maybe I'm seeing the wrong amendment. You say 221.
Subdivision 6.
Oh, that's subdivision 6. I'm sorry. Yeah. Okay. Representative Hicks. Thanks, Representative Coulter. So Representative Hicks. Do you have any thoughts on that? It may be that we could defer. You maybe want to have a testifier assist with that. Either way, Representative Hicks.
No. The reason we got rid of the reporting requirement was because we made it a competitive RFP, so there'll be ongoing reporting going into it. Having the department make somebody that they've already made report throughout the entire time report again is just a waste of state dollars. So that was the reason for that. Sorry.
Representative Hudson.
So redundancy. Got it. Thank you.
That's right. Thank you. Representative Coulter. Okay, my goodness. Okay.
Thank you, Mr. Chair. I'm a little bit confused why we're deleting lines, page 2, lines 11 through 13, because it also, the way I read this, and it's entirely.
So we just, on
Representative
line
Hicks.
10, oh, I'm sorry, Chair.
That's right.
On line 10, we changed it to purchase diapers and wipes and maybe used up to 4% of the cost to administer the grant. So we just condensed it down because we turned it, so the long and short of this is, I have heard loud and clear from the GOP, from my colleagues on the other side, that they are not huge fans of direct appropriation grants. And so I took the bill and I made amendments to make it a competitive RFP. Like that was the goal here, was to make this competitive and open the dialogue to potentially others.
Good, and I'm grateful for that too, I should say. That, in fact, I should maybe just say just generally that being able to move in a direction of rather than appropriating funds to individual organizations and instead having the agency have a competitive grant process, I just think is a better way in general for us to go. Not that that's going to be true in every case, but I do think, so appreciate that, Representative Hicks. I'm thinking we should get the bill in the form that she wishes, probably as a step here. No problem, don't mind either of the members raising that, but unless there's further discussion to the A1 amendment, all in favor of getting the bill in the form that the author wishes by adopting the A1 amendment, please say aye. Aye. Any opposed? Okay, thank you, members. So that motion passes. Representative Hicks, let's have you present your bill.
Thank you so much, Chair and members. And I do thank you for the discussion about the amendment, because I know it's a little bit different, but I took a previous bill and I tweaked it, and so my initial thought was, oh no, I hope I didn't break that. But it does not appear that I did. So I really want to thank you for hearing it. Parents and young children are struggling with increased costs for housing and childcare. And many parents are struggling to afford diapers, and they end up stretching the time between changes because there is a cost associated. Diapers and wipes are not covered by WIC or SNAP, and so many times some of our lowest families are trying to get them from diaper banks. And they've been one of the really high demand baby items that we've seen. This bill establishes a diaper distribution program with appropriations in 24 and 25. Grants would be awarded to eligible applicants to provide diapers and wipes for families in need. Eligibility criteria would include having an established network for diaper distribution. So whoever's, as I stated before, this is the first time this would be competitive. So we had to list some eligibility criteria. We would want them to have a network for distribution, infrastructure for managing procurement, and relationships with national organizations who address diaper needs, and a commitment to working across the spectrum of ideas and political spectrums to really work with families. A commitment to working in a culturally sensitive ways, particularly in the areas of high poverty. I will let my testifiers speak to the broader concerns around diaper need in the state of Minnesota.
Thank you. Thank you so much, Representative Hicks. And so if the testifiers can make your way on up, I guess the first one, Deirdre Conzer, and we'll have Michelle Winkleman be sort of on deck. Yeah, you can all sort of make your way up a little bit anyway. Find a seat. And once you get settled in, identify yourself. Yep, come on down. And please identify yourself and proceed with your testimony.
My name is Deirdre Conzer, and I'm the Executive Director of the Diaper Bank of Minnesota. I do want to thank Representative Hicks for authoring this legislation, as well as you, Mr. Chair, and committee members for allowing me to share information with you about diaper need. According to the National Diaper Bank Network, 1 in 3 American families reports having an insufficient supply of diapers to keep an infant or child clean, dry, and healthy. To make ends meet, many parents reuse soiled diapers or use household items such as T-shirts, paper towels, or plastic bags to cover their babies' bottoms. Not surprisingly, this lack of clean diapers can lead to health risks for children, such as severe diaper rash and infections. Diaper need also impacts families' employment status and overall economic health. Limited diapers can impact access to childcare, as most, even free and subsidized facilities require parents to provide an adequate supply of disposable diapers. Nationally, 57% of parents experiencing diaper need who rely on childcare said they missed an average of 4 days of school or work in the past month because they didn't have diapers. Currently, no state or federal child safety net programs allocate dollars specifically for the purchase of diapers. Meanwhile, a 2016 study found that providing diapers to families resulted in financial benefits related to health care, employment, and education. Overall, it found that personal income increases 11 times for every dollar invested in diaper assistance. The proposed state funding would significantly expand diaper access for families in need. It would support infant and toddler health, increase child care access, enable more parents to work, and increase families' economic well-being. Please support House File 2665 to ensure that every baby is clean, dry, and healthy. Thank you, Mr. Chair and committee members. I'd be happy to answer any questions about diaper need or the Diaper Bank of Minnesota.
Thank you so much. Yeah, I know there's two other people signed up, and I'm sure they're just here for questions, though. Or are they going to be speaking? Yeah, sure. Come on up. Yeah, I might ask each if you can just do just a minute, please. Just get a little bit tight on time. But yeah, please identify yourself and proceed.
Thank you, Mr. Chair. My name is Michelle Winkleman, and I sit on the board of the Diaper Bank of Minnesota as the treasurer. To begin with, thank you, Representative Hicks, for authoring this legislation. Thank you, Mr. Chair and committee members, for your time. I appreciate the opportunity to speak with you. As I sit here today, I'm a successful professional and a breadwinner for a family of 5. But let me take you back almost a couple of decades and what you would see as a young woman with a toddler and a baby, both girls and both in diapers. This young woman was making her way out of a bad situation and carved out her path forward with public assistance and the GI Bill in order to finish college and start a career. But in order to even start down this path, we had to have diapers. Access to diapers meant that my daughters could go to daycare so I could go to class. Diapers meant that my babies felt safe, secure, and loved as I was able to meet a critical basic hygiene need. And ultimately, access to diapers means that there are 2 young ladies who are lighting up the world today with their gifts. For 2023, the Diaper Bank of Minnesota received requests for 2.4 million diapers. These diaper requests represent approximately 40,000 children who all deserve the same care that I was able to provide my children. With an additional $500,000, we could have said yes to everybody and made inroads in the statewide diaper need, where it's estimated that there are approximately 90,000 children that need our help. In supporting our youngest Minnesotans, addressing diaper need is one of the most effective uses of funds in terms of clear, concrete impact in both the near term and the long term. Thank you again, Mr. Chair, committee members, for your time and attention and the opportunity to speak today. I'm happy to answer any questions you have.
Thank you so much. Yes. And then the final testifier signed up, Shoshana Kraft. And please identify yourself. Yeah. Once you get settled in and proceed. Again, we've got probably just got a minute or so, I'm afraid. But yeah, please.
Okay, thank you.
Yeah.
Buju and Denway Maganug, Nino Kazi Kwe, Indigenous Cause, Makwa and Dodam, Kawababi Gani Kag and Dunjaba, Kakabi Kong and Dadnongum. Hello, my relatives. My name is Hummingbird Woman. Some people call me Shoshana Kraft. I work at the Division of Indian Work as a director of programs. I supervise many programs, including the Maternal Child Health Program, which include women of traditional birthing, the Ninde Doula program, and the FASD program as well. First of all, I want to say miigwech to Representative Hicks for authoring this bill, and we appreciate your hard work. Thank you, Mr. Chair and the committee, for being present and hearing our testimonies. Division of Indian Work is grateful for our partnership with the Diaper Bank of Minnesota. We have been partners for 6 years. Division of Indian Work supports and impacts families statewide. Our Ninde Doula program assists our relatives as far away as Red Lake, Onamia, and Hastings, Minnesota. Our doulas travel to meet the needs of our pregnant and postpartum families. We provide baby bundles, baby supplies, and most importantly, clean new diapers for families. Our food pantry alone served over 9,000 individuals in 2022. Many of these same families who struggle to keep food on the table do not have the funds to buy diapers. The Diaper Bank of Minnesota provided 18,000 diapers and 37,000 wipes to Division of Indian Work in 2022. This was not enough to meet the critical hygiene needs for our families. We received donations from churches, individuals, and we purchased diapers to supplement the need. Many of our families live in rural Minnesota, where it is hard to make it to the next town. Many families have to make choices whether to buy diapers or to use other means. It is vital for our agencies such as ours to provide the basic needs, including diapers to families. Mr. Chair and committee, with your help, and the help is needed now, we can provide the much-needed clean diapers and wipes to families across the state. Once more, I want to say thank you to Mr. Chair for your dedication and hard work and time to be here to hear our testimonies so that we can help our families across the state and for our future generations. I'm happy to answer any questions you may have.
Thanks for being with us, and thanks for your important work that you do outside the committee, too. Thank you. Is there any member of the public who wishes to testify on the bill? Not seeing any, so I'll see member questions or discussion, what there is. Well, actually, so let's go Representative Hudson, then we'll go to you first. Representative Hudson.
She called it.
Okay.
Thank you, Mr. Chair. I got to say, Representative Hicks, I suspect that your eligibility requirements may have been modeled after Diaper Bank of Minnesota, and I'm not even upset about it. It's, I actually respect it because, as you stated, you're making an effort to try to get away from this naming of specific recipients, so I appreciate that. I also appreciate in line 119 and 120, demonstrating commitment to work with organizations across ideological and political spectrums. That, of course, should have nothing to do with whether or not we're helping babies have diapers. So I very much appreciate that. My one question is, in lines 117 and 118, the ability to advocate for diaper need at local, state, and federal levels. What does that mean? Are we talking about having a lobbying arm?
No.
Representative Hicks.
Sorry, Chair. No. No. No.
A big diaper, I think, is the.
It is very late. Can we just talk about how late night committees get weird? Okay.
Really do get weird.
This is about making sure that whatever organization is doing this is facilitating this for the whole state and is advocating for the overall needs, right? Because if we don't have an organization that can come back here and testify and have conversations with us and gather local support to fill in the gaps that this bill is going to leave, right? Because it's not going to fully fund, then we're not going to get diapers on the tushies of all the kiddos. So we need an organization that can do that can build relationships, that can have those conversations, and can do that strongly so we can make sure we can meet the entire need.
Representative Hudson.
Fair enough. I appreciate the answer.
Okay. Vice Chair Keeler.
Thank you, Representative Hicks. I love diapers. I know that we've talked about it as somebody who was a licensed MIFBA mom for a really long time, we would get babies that were removed from their home with really awful sores. And a lot of it had to go back to the hygiene options that they had. Diapers aren't covered in a lot of the state supports. And when we worked on the food shelf bill, we were really clear in the statute there that it wasn't just food that could be provided in those spaces. But again, emergency food shelves are giving out a day or two worth of diapers, and we obviously need more than that. And so I really appreciate this, and I just want to call out that this is an act of family preservation. It's things like this when we invest in the communities to offset the needs that they have. It really, in the long run, helps our families stay together. I know that that's a really weird connection, right, to diapers, but it's also a thing that is stolen a lot because it's just something that young parents need. And so I appreciate you doing this. I appreciate the work that all of you keep doing. That's it. Thank you.
Thank you. Other member questions or comments? I'll maybe just note, slightly building on Vice Chair Keeler's point, that I guess I view this as being part of, and I would love to, in fact, think about how to expand this, as being part of, hopefully, a consensus around saying that anybody who has a baby in this state, we're going to take really, really good care of you. In light of some debates that we've had about reproductive rights and other issues, to at least say that I would hope there'd be great consensus from everyone around the table that we're going to take very good care of folks, of everybody in our state, and then certainly people who have little kids who need diapers. And so this is a really exciting piece, and I guess makes me think about other ways in which we can provide support for pregnant people and for people who have young kids. And so I really appreciate the work on this and want to explore how we can do that. Representative Hicks, you get the last word on your bill.
Thank you so much, Chair and Committee, and thank you for the thoughtful discussion. I really, really do appreciate it. I agree with Representative Keeler. I think when people's basic needs are met, we are more likely to keep families together, and that's good for our community. And I also think diapers are really, really expensive. And when you have to travel and use gas to get somewhere and spend $40 on a box of diapers or $40 on groceries, that is a really hard decision for people to make. And so I am excited that everyone heard the bill today and is supportive of the bill, and I am hopeful that we can move this forward in our larger package. So thank you so much.
Thank you, Representative Hicks. Thanks for all your work, and then the folks from the Diaper Bank. This just could not be more important work. We really appreciate it. Thank you. So with that, members, the chair lays over House file, and make sure I have that bill number correct. Where did that go? Thank you. 2665, as amended for possible inclusion in our budget bill. Thank you so much. Representative Coulter, why don't you head back on up? And members, I feel like we should just do this way. We're going to have the pages, if you could please distribute the fiscal note. I think we'll take just a minute on this. This is House File 993. We had it up before. And Representative Coulter moves House File 993 to bring it back before the committee. And there may not be too much to discuss on it, but I kind of feel like we might as well, since we're together and we have the document, just to kind of do it up right. And so we're having that distributed. And thank you. And as it's being distributed to folks, I'll just see if there are questions anybody has regarding the bill or the fiscal note before I lay it over yet again. Have that at all? Representative Lee.
Thanks, Mr. Chair. While folks are getting the hard copy, I peeked online because the fiscal note was available under the bill profile and wanted to just maybe get an answer from maybe nonpartisan staff on why the cost goes up and then it goes down in the fiscal note.
Ms. Beckel, if you have a sense as to that. And perhaps if you need a clarification, Representative Lee, pardon me, is what she's asking about. Yeah? Ms. Beckel.
Thank you, Mr. Chair. Solveig Beckel, House Fiscal. Yes, so when we're looking at any programs that go through the Minnesota Department of Education, typically the first year you will only see 90% of the cost because programs through MDE are shifted. That is, in the first year they receive 90%, and then the next year they receive 10% of the previous year's cleanup payment. That means that when you just start a program, there is no 10% prior year cleanup payment. So we're only seeing 90% of the total cost. So that's why you're seeing a lower cost. And you can see that on the smaller chart on page 3. In terms of why the cost is slightly higher in fiscal year 25 than in 26 and 27, this is generally related to the number of students that will be screened, and MDE is tracking declining enrollment. So that's just the number of students that would be screened.
Representative Lee, does that answer you? Yeah?
It does. Thank you.
Okay. Members, any other questions or discussion regarding HF 993? I am not seeing any, but I'm glad that we have the fiscal note. Representative Coulter, we'll give you, again, a chance for any kind of final word you want. I think you probably had it before, but anything?
Mr. Chair, I'm a man of few words.
Okay.
Thank you.
Good call at 8:15. So with that, the chair lays over House File 993 for possible inclusion in a budget bill. And members, I'm going to go up to the testifier table, have Vice Chair Keeler take over, and we're just going to do a little bit of business. And Madam Chair, I will have a motion when you're ready.
Go ahead, Chair Pinto.
Thank you. The motion is to move House File 2293 to the General Register, and I'll maybe just explain the motion, saying that the bills, we're about to move 3 bills that are vehicle bills that are intended to provide some flexibility as the session moves on. This is a pretty standard thing to do for those who are in their first terms and new here. We're actually not going to move House File 2292. There's a lot that Ms. Colbert and I are kind of juggling, as we've got the MDE side of our work and the DHS side of our work, and trying to match up with the Senate and those sides, and happy to explain more. But for now, Madam Chair, the motion is to move House File 2293 to the General Register.
Okay. Any member discussion? Okay. I'm sorry.
Okay. No, all good.
Too late. All those in favor, say aye.
Aye.
Opposed, say no. Seeing none, House File 2293 is moving to the General Registry.
And then I have two more motions, Madam Chair.
Okay.
House, if I may, House File, I move House File 2698 to be re-referred to the Committee on Ways and Means. So we'll do that one next.
Any member discussion? All those in favor say aye.
Aye.
All opposed say nay. Hearing none, the House File 2698 moves to Ways and Means.
And then, Madam Chair, the final motion is House File 2476, move to be placed on the General Register.
Any member discussion? All those in favor say aye.
Aye.
All those opposed say no. Hearing none, House File 2476 is moved to the General Registry.
And then finally, Madam Chair, if I may, just a preview for folks on Thursday, we'll be hearing the governor's budget bills in our area. It's two different bills, so one for DHS, one for MDE and children and families. That'll take up the bulk, the whole session on Thursday. A reminder that we received a presentation on those bills in late January, so there's a PowerPoint presentation. We'll have that available, but we're really going to just dive into the actual details of the bills and bill language. And so that's all I have, Madam Chair.
With that, we'll see you tomorrow morning. The committee is now adjourned.